Electing to have surgery is never an easy choice. But now South Florida has an option that lessens stress surrounding that decision and brings calm and confidence to your choice. I'm here at MY VIP with Dr. Brusovanik, the spine doctor of Miami. Doctor, tell me about what you do here at MY VIP and what you do on a regular basis.
Thank you, Hunter. I have the lucky job of taking care of patients who have back and neck pain. I specialize in, primarily as a doctor, in making a diagnosis. Patients are suffering sometimes for years without knowing what's causing the pain. So my job primarily is to figure out why they're suffering. Then, when we figure out and we know for sure what the cause of pain is, we try conservative means to get them back on track. And if that doesn't work, I come in with my part, which is my minimally invasive operations, where we sneak in, correct the problem, and sneak out.
Here you also operate as a doctor first.
Absolutely.
And then you want to educate somebody on how to help them in the last resort is a minimally invasive surgery.
Absolutely. It's important to be certain what is the actual cause of pain. But one thing I can tell you, when neck pain begins to feel with radiation down the arm, when back pain starts to shoot down the back of the thigh, that's nerve pain, 99 out of 100 times. So after a conversation, after we figure out how long the patient's been suffering, after we figure out what makes it better, what makes it worse, and what have they tried, after the physical exam, the things that we try to do include physical therapy, properly targeted epidural steroid injections, which really get 90% of patients to avoid surgery. And then for the few patients that at the end continue to have pain, we talk about potentially doing something surgical.
Your goal is to not have to get to the surgery, but to solve the problem in another way.
You got it exactly.
What makes MY VIP different?
I would say the staff. The staff really takes care of patients like family. I do spinal robotic surgery, and that has increased the precision of some of the instrumentation methods from 96, 97% to essentially close to 99%.
In your world, that's a big difference. That's a big change.
It is, because if you operate on 100 patients and one is unhappy, that's one too many.
Yeah.
So this is a zero error kind of a game.
Wow, that's really impressive. That's a big deal to be able to take your small margin of error already to make it almost non-existent.
Very humbling.
Very humbling. Yeah, it's great. Well, it's been very humbling talking with you, Dr. Brusovanik. We appreciate it.
Thank you, Hunter.